Breast cancer, most of the time, starts with some physical symptoms like breast lump that can be picked up. Some can be in form of skin rashes on the nipple, on the breast. It can even be in form of redness, change in color. It could be such a way that even the breast can get retracted inside. There are some things that can be seen that can give a clear picture that this is a breast cancer. And essentially, it is better if it's identified as a lump, which increase the chance of survival compared to when it's already started having all these symptoms, not to talk of even getting metastasized or moving to the brain, to the lung, to the bone, and to the liver. So to avoid all these complications, the best is to prevent it. So that makes screening and self-breast examination as the primary step that's been advocated. And the first is to have what we call breast self-examination. Women are encouraged that for each month, usually at the end of the week or within 1 week after completion of their menstrual cycle, they are expected to examine their breast to check for it, and it not only help them to identify that whether there's a lump or not, it also help them to be able to identify how their breast looks like, so that if there's going to be any difference at any point in time, they can really pick it up that, oh, this is different from the way it used to be. So that is very important. Also, another important way to also take care of this condition is to do what we call clinical breast examination, and this is done by the nurses and doctors. It's advisable for young ladies between 20 and 40 years of age to do this at least once in 3 years, while those who are 40 years and above are advised to do this at least once in a year, so as to be able to identify and pick whatever they might have missed in the course of their monthly breast self-examination. For those women who are pregnant or for women who have stopped menstruating, they can decide to choose particular dates, and that particular day of the month will be the regular time they will be doing their own breast self-examination. And beyond this, there's also provision for what we call mammogram. Mammogram is a machine that uses low dose ion radiation like X-ray, such a way that they will position the breast within it and be able to scan through it and give a picture of how the breast looks like. And if there's any lump, even at a very early stage, this machine can pick it up. This is advice for those who are 40 years and above. However, for those who have a family history, genetic predisposition, maybe the family mother or aunt or cousin has breast cancer, such can be asked to start their own at early period compared to others. So these are the steps that can be taken to prevent it.